So with me, I have Berris Burgoyne, who is a renowned naturopathic clinician with 33 years of experience. She owns and runs a naturopathic practice in Brisbane, Australia. She is a well-known international speaker. She has lectured in Australia and New Zealand, has also lectured extensively in the United States, Canada, the United Kingdom, as well as South Africa. And what sets Berris apart as a speaker and educator is her ability to take very complex technical data and transform it into practical clinical information that is easy to understand and apply. And this, coupled with her extensive clinical experience, makes her an authoritative and dynamic presenter. And thank you so much for agreeing to do this interview, Berris.
Thank you very much. It's a pleasure to be here with you.
Yeah, no, I look forward to this. And usually I get started by, and this is one area where we didn't touch base too. So this, for the editor, I want to ask you before we do this, your background. So I don't know if you want to give your background, because again, that relates to or if you could give your background without really talking about it, or you want to just,
I think just leave that, because really without talking about MediHerb, it's really just that I've been in clinical practice,
Okay. So we're going to leave out the background. We'll just get into.
I think, yeah.
Okay.
Yeah.
So we're going to resume here. I'll give a clap here. So Berris and we are going to discuss the importance of herbal quality and really get into talk about bugleweed, other herbs that could benefit thyroid health. And, again, look forward to you sharing your knowledge with us, Berris. And so can you start out by discussing the importance of the quality of the herbs?
Certainly. Look, I've been a naturopath, and my main modality in doing that for the last 33 years is herbal medicine. That's where my real passion lies. And I've always been very, very careful about the quality of the herbs that I use. And there's a brand in Australia that I use called MediHerb, and they're also available in the United States. And I've always used that brand of herbal medicine because it's I'm really confident in the testing procedures they use to make sure that they're giving practitioners the very best quality herbs. And when we're talking about herbal quality, it's very, very complex. So, we have to start thinking about, how's the herb growing? Because the reason we use herbal medicine is that they're full of phytochemicals, these magical ingredients that are what have the activity in our body that we're using them for. So, we have to think about how they grow and how they're harvested, how they're dried, and then how they're processed after that. So, there's a lot of testing that has to go in when a company gets a herbal medicine in to sort of make sure, first of all, that it's the correct species, that it's a correct herb. So they do a whole lot of different testing for that to make sure that it's not adulterated with anything, because that's not all that uncommon, to make sure that it's a correct herb part that's used, because there's, plants, of course, have lots of different parts, and people don't always differentiate between the different parts of the herb that are actually used. They'll just talk about the herb per se. And we see this, sometimes in research, where they'll do some research on a herb, but you don't really know what part it's used. And a really good example of the importance of this is something like nettle root or nettle, for example. Most people would know of nettle, it's stinging nettle. And we use the leaf in herbal medicine as a really good, what we call a depurative herb, which is, very good for the skin, very good cleansing, internal cleansing herb. But then we use the root for prostate problems. So we really, have to know the part of the plant that we're using. And if we're using the wrong part of the plant, then we're not going to get the benefits that we're after. And in many cases, we won't get any benefits at all. So that's very important. So you have to test the herb when you get it in and make sure it's a correct herb. Then you have to test during the procedure of making that liquid herbal extract or the tablets, and then test the finished product to make sure it still has the level of the active phytochemicals in it that we need. So it's very, very, very complex, and I feel very confident that the brand that I use really goes to all goes through all those steps to make sure we've got very good quality medicines, because that's what I want to give my patients. Because ultimately, if I'm not giving them good quality medicine, we're not going to see good clinical outcomes. So, and that's what I want for my patients, as we all do.
Yeah, no, that's true. That is definitely important, of course, because we want people to get better. And is it true that, at least I've heard, that Australia has a lot higher standards when it comes to herbs when compared to some other countries?
Yes, we do have very high standards. We have the TGA, the Therapeutic Goods Organisation, that actually oversees the manufacture of all medicines. And unlike the United States, in Australia, herbal medicines are classed as medicines. They're not food supplements or dietary supplements. They're classed as medicines. So anybody manufacturing herbal products for sale to practitioners, etc., they have to do it under what's called GMP, good pharmaceutical practice. And that covers all medicines, whether you're producing pharmaceutical drugs, whether you're producing nutritional supplements, or whether you're producing herbal medicines. So, you know, any company that has that GMP TGA license can produce, you know, they're set up in exactly the same way as a pharmaceutical company is, with the same stringent guidelines in place. So, and they get audited, you know, auditors from the TGA can just turn up and do an audit. So.
And then you also mentioned different parts of the herb are important. So this goes for all the herbs, like echinacea, for example, is a well-known one. Ashwagandha, like, you know, like is that, and that's something that most consumers aren't aware of. So do you see where, not to knock other companies, but some companies might use the wrong part of the herb, maybe it's because they don't know any better, or maybe because it's less expensive to use different parts of the herb?
Yeah. Look, mostly for herbal medicine, people will be using the right part because, you know, they know. But, you know, tribulus is a really good example of this. In Western herbal medicine, we tend to use the aerial parts of the tribulus plant, so the leaves, and most people have heard of tribulus. So, but it's been used in other traditions of medicine. The fruits have been used. So, you know, that's a very valid medicine in that system of medicine for what they use it for. But when we're talking about using tribulus to improve male and female reproductive health, for example, we need the aerial parts, the leaves, because that's where all the research on that topic has been done. So, and you do see, you know, I see in health food shops over the counter sales of tribulus, and sometimes it's tribulus fruit, which is very valid, but you can't then think it's going to help for these other things where the research has been done on the leaf. So, yeah. And look, I personally think that's where going to a physician, a naturopathic physician, or someone who's specialising in using herbs and nutrients, whether they're chiropractors, naturopaths, acupuncturists, doctors sometimes, go to a professional to get what you need, because I've seen patients that have wasted a lot of money just going into health food shops and buying products that they've read about on the internet, or, you know, their neighbours told them about or something, and it's often not actually what they need, so can easily waste a lot of money.
Yeah, that's true. A lot of people just read about something or watch a video and then get it on their own, or they might ask the person working at a health food store who might just have very basic knowledge. So you're right. It is a good idea to work with a qualified healthcare practitioner who has knowledge when it comes to the quality of the herbs. So thank you.
Absolutely. And when you go into a health food store, those people have got very limited time. They're giving you the advice the best they can under the circumstances. But when you go to a practitioner, a practitioner is going to be gathering all the information they need to prescribe very appropriately for you. So that's extremely important.
Now, I also wanted to ask you the difference between using, alcohol, specifically ethanol, versus glycerin, because there are some people who are cautious about using herbs that have alcohol, that have that ethanol. But can you talk about some of the advantages, disadvantages of each?
Yes, look, this is a really interesting topic, and I can totally understand people thinking, oh, there's alcohol in this herbal medicine. I don't know that I want to be using that. So, I'll get the glycerin-based ones, or the glycitracts they're called. And we would probably all do that if it was viable to do that, but it's not, because the reason that alcohol or ethanol, pharmaceutical grade ethanol, is used to make herbal extracts is that the ethanol is a fantastic solvent. So it draws out all the phytochemicals from that herb. So glycerin doesn't do that. It doesn't draw out phytochemicals of very many herbs at all. And the other thing is that ethanol is a very good preservative, whereas ethanol's not. So, you can get herbal extracts that have a shelf life of, a few years, depending on the level of ethanol in them. So even though glycerol is a nice idea, it doesn't work for most herbs. One herb that it works very well for is marshmallow root. And, you can get that. I use that in a glycitract in my clinic because it works very well with marshmallow root. But for most herbs, it doesn't work well. So you can buy a liquid herbal medicine that's a glycitract, but it's not going to have the level of phytochemicals in it that you need to do the job that you're using it for. Sometimes companies will make an ethanol water extract of the herb, and then they will take the ethanol off and add glycerin to it. But the problem with that, and that sounds like a good idea too, except the problem with that is that then those constituents that are soluble in ethanol or alcohol are not then soluble in the glycerin, so they just all fall out to the bottom and they don't mix through properly. So look, I think most companies would be making glycitracts if it was viable and if you could make very good quality herbal medicines doing that, but you can't. And when you think about the amount of ethanol, if you were to get a herbal formula, for example, from your healthcare practitioner, you could think that maybe in that whole formula, there'd be an average of maybe 40 or 45% ethanol, and that sounds like an awful lot, but you're only taking a 5 ml dose or maybe a 7.5 ml dose in most cases. So if you think about the level of ethanol in that, it's not very much. It's maybe, a third or less or quarter of what you would get in 100 ml glass of wine. And I'm not sure what that is in ounces, actually. I should have looked that up. But I know you have wine, or from memory, in 6 ounce and 9 ounce. Is that correct?
I'm not much of a wine drinker, so I can't tell from self-experience.
The thing is, it's much, much, much less than you would get in a standard drink. Much less. Your standard drinks in the USA are much smaller than ours. I think they're 150 ml. So if anybody wants to look that up in ounces, it gives you an idea. So very little alcohol in there. And our body is actually designed to metabolize small amounts of alcohol because we actually produce alcohol in our normal day-to-day metabolism, internal metabolism. So the liver is very well designed to metabolize small amounts at any one time. So, and look, when I think about this and I get asked things like this, I just think, look, I've been in clinical practice for 33 years. I use a lot of liquid herbs in my practice along with the herbal tablets. And I have never seen an issue. I've only ever seen very good results. And probably for the first 10 years of my clinical practice, I used only liquid herbs because we didn't have any good quality herbal tablets in Australia. So I used only liquid herbs. So every single one of my patients got 1, maybe 2 different formulations to take.
Okay.
So,
No,
yeah,
thank you. So it's a small amount of alcohol, which I realize, but then also, it's a better preservative, so it lasts longer on the shelf. But perhaps most importantly, it just has a higher amount of phytochemicals, so it's going to have a greater therapeutic effect with the ethanol compared to the glycerin. Correct?
absolutely, absolutely. Some herbs will work well with, making them as an alcoholic water extract and taking the alcohol off and adding the glycerin. St. Mary's thistle works well with that, but most herbs don't. So you're not going to get good therapeutic activity if you're not using good quality medicines. That's the bottom line. And basically, you're absolutely wasting your money.
All right. Well, thanks again for sharing, Berris. And before we started this interview, I briefly told you about my experience with Graves and how I took bugleweed, specifically the Mediherb bugleweed. And so, can you talk about bugleweed, some of the indications for those who are unfamiliar with it?
Absolutely. Look, bugleweed is a herb that we use for hyperthyroidism, so high thyroid function. The botanical name of the one we use here is Lycopus virginicus. In Europe, they use a different species called Lycopus europea, but they're exactly the same. They're interchangeable, basically. And the research is often done on the European one because that's where a lot of the research is being done. But there is definitely research to show that bugleweed or Lycopus species is very good for reducing thyroid hormone in patients with hypothyroidism, whether it's whatever the cause. And most times when people have Graves' disease, for example, it will be that is an autoimmune disease, and it's the most common cause of hyperthyroidism. There are other causes as well, but whatever the cause, Lycopus is the key herb that you would use for. So for us, it would be bugleweed. In Europe, it's called gypsywort. So, and that is the only use for it. You don't use bugleweed for anything else because it will reduce thyroid function. Of course, we want to do that if we've got overactive thyroid, but not if we've got normal or underactive thyroid. And it's an excellent herb. And that's my key herb that I use in my practice to support patients with hyperthyroidism, and works extremely well.
Yeah, same here. That's the main herb I recommend for those with hyperthyroidism, just because I had a lot of success with it. And can you explain? I don't know if you have an answer, but I'd like to pick your brain why some people, I find that bugleweed works for a lot of people, but there is some people where it just doesn't seem to work, and maybe they do need to take the anti-thyroid medication while trying to address the cause of the problem. And so, and I'm sure it's not just bugleweed, it's with other herbs as well. So can you maybe talk a little bit about why bugleweed or other herbs might work wonderfully in some people, but not in others?
That's a really good point. And I treated a lot of thyroid conditions in my clinic. It's one of the areas where I've specialized as well. And, partly because, you said you've had a history of Graves' disease. I've had a history of Hashimoto's, which is an autoimmune thyroid disease causing hypothyroidism. So, I think when we have a condition, we know a lot about it. And so mostly in my clinical practice, I've seen patients with hypothyroidism, but I've certainly seen a lot with hyperthyroidism. And my experience with hyperthyroidism is exactly the same as yours. Most patients will respond well to the herbal medications, but some you just cannot get on top of it. And they have to go on the anti-thyroid pharmaceuticals. And that's something I think as practitioners we have to face, that sometimes what we do works, sometimes it doesn't, so then we refer them on. And quite often when we see these patients, they're also under the care of a physician or maybe an endocrinologist or whatever. and often we're working in conjunction with that. You wouldn't give bugleweed to someone who's already taking those anti-thyroid medications, though. You do one or the other. You don't do both. So, and I think for me, my experience is that hyperthyroidism is a little bit harder to treat than hypothyroidism, and it depends how far advanced I think it is when you see the person, and it depends on the underlying health of the patient, their lifestyle, whole range of things, and sometimes it just comes down to genetics and how susceptible.
Good points.
Yes.
Yep. I mentioned that I took the MediHerb bugleweed, and so one of the questions I had is what differentiates the MediHerb bugleweed from other brands? And I think you kind of mentioned it. You said that it uses the Lycopus virginicus for some reason, I thought that it had a couple of different types of bugleweeds, but it's specifically the Lycopus virginicus.
Yeah, mostly it would be the Lycopus. Sometimes it might just say Lycopus species, but Lycopus species generally reduce thyroid function. So look, I think again the reason why it's certainly the MediHerb one that I use in my clinic as well. I think you can be guaranteed a good quality, that it is what it's supposed to be, that there's no sort of somebody's made a mistake when they've harvested or something, and harvested the wrong plant or whatever, or it's not adulterated with anything, etc. So, like as I say, I've only ever used MediHerb herbs in my clinic, so I don't have experience with others. But I do sometimes have patients come in and say, look, I've been using this and it doesn't work. And I say, well, try what I use and I think it will probably work. So.
Yeah, and that's why I want to bring it up, just because as of this recording, hopefully this won't be the case too much longer, but the MediHerb bugleweed has been on back order, so I haven't been able to recommend it. And then, since then, I've had a number of people say that the other herbs that they have been taking hasn't been as effective as the bugleweed. They were taking the bugleweed, and then once it was on back order, they had no choice but to switch to something else. And not to say that the other herbs didn't work at all, but again, I'm realizing how good of an herb bugleweed is, because I do get people that mention that this brand or this brand, I've been taking this and it's just not working as well. Or again, when we do a follow-up thyroid panel, it's just not having the same effect. So that's why I wanted to bring it up, just because it's a unique situation with it being on back order for so long, and just seeing the effects of other herbs. And to be fair, bugleweed's not like ashwagandha or milk thistle or other herbs where you could find those herbs in every single health food store or many places online. There's only a handful of companies that have bugleweed.
Yes, that's correct. And for many herbs that we use in clinical practice, there might be, oh, well, that's out of stock, or I'm out of stock in my dispensary at the moment, so I could use this other herb instead. That's when we're treating nervous system problems, for example, there's a whole range of herbs that we can use. But when we're talking about bugleweed, there is no substitute. It's bugleweed. It's the herb for hyperthyroidism, to directly deal with the thyroid and reduce the production of the hormones, etc. So there is no substitute for that. And the whole things being out of stock, as a practitioner, since 2022, with the beginning of the COVID pandemic, supply chain issues for everything that we deal with probably, but including the medicines that we use, because manufacturers can't get the raw materials because of supply chain issues, and 100 ships sitting off the coast of different countries waiting to dock and unload and that sort of thing. And then, of course, it's getting things from the manufacturer to my clinic sometimes. It's very, very difficult. And it's been, as a practitioner, it's been very frustrating, but it's one of those things that there's nothing we can do about it. It's happening around the world for just about every single thing we use in daily life, really.
Yep, very true. Can you discuss some of the other herbs that can benefit thyroid conditions?
If If the thyroid condition, if the hypothyroidism in this case is Graves' disease, so if it's an autoimmune disease, then as a practitioner, I would also, excuse me, I would also treat the immune system to deal with that autoimmunity, because if you can have an impact there, then of course you can deal with the hypothyroidism through that route as well. So what's happening in Graves' disease, for example, is that you've got antibodies that sit on the receptors. They're called thyroid stimulating hormone receptors, TSH receptors. And basically when those antibodies that we produce that are part of the autoimmune disease sit on those receptors, they keep telling the thyroid gland to keep producing more thyroxine, even when we don't need it. And that's why the thyroxine goes high. So if we can modulate the immune system so that we can maybe reduce the production of those autoantibodies, then we're also solving the problem somewhat as well, particularly when we do that along with the bugleweed. So for me, echinacea, and everybody's heard of echinacea, echinacea is a great herb for immune modulation. And there is some research showing, just in one particular autoimmune disease, showing that it can be beneficial in autoimmunity. So that's one herb that I use a lot in my autoimmune patients, whatever the autoimmune disease is. But then there's other herbs we can use, like there's an Ayurvedic herb, comes from the Indian tradition of medicine, called hemidesmus, that I use a lot in my clinic. And that's a very mild immune suppressant herb. And it tends to, in my clinical experience, it tends to bring down the production of those autoantibodies. And then I might combine that with anti-inflammatory herbs, for example, like Romania, feverfew, etc. And I often give that in a tablet formulation, but sometimes in liquid. Echinacea I use in tablet or liquid, and I use echinacea root. And what I use is often a combination, or always a combination, of echinacea angustifolia and purpurea roots, because that's what I found works much, much better.
Okay, yeah, it's interesting you mentioned echinacea, just because I think a lot of people are familiar with echinacea when someone has a cold, but
Yes.
not so much with autoimmunity. And there are some people that are concerned about taking echinacea with autoimmunity. The concern is that it might possibly exacerbate the autoimmune response, but in your experience, that hasn't been the case.
No, just the opposite, in fact. And I think that very early on, when we started using echinacea as a common herbal medicine, of course, the First Nations people in the United States have been using echinacea angustifolia root for as long as they've been there. And that's where we've got a lot of our traditional information from echinacea, about echinacea from. But in the early days of pharmacological research on echinacea, there was this, it stimulates the immune system, therefore, it probably can make the immune system overactive. So if you've got an autoimmune disease, it will worsen it. But it was just really a lack of really good understanding about how echinacea works. And there's evidence to show that echinacea primarily works on the innate immune system. We have the innate immune system, and then we have the adaptive immune system. So the adaptive immune system has the antibodies. So really, echinacea primarily works on the innate immune system. And there is research to show that many people with autoimmune diseases have a deficient innate immune system, and that they think that the origination of the autoimmune disease is a problem in the innate immune system. With specific cells, they're called the dendritic cells, but in the innate immune system. So if we can use anything that can really support the health of the innate immune system, then I think we're going to benefit the patient, not only in helping with their autoimmune disease, but also keeping their general immunity up to help them fight infection efficiently. And echinacea should be taken long term. We also read sometimes that it should only be taken short term because it can wear the immune system out, and that's absolutely not correct either. It does work better if it's taken long term, and you don't need a high dose to do that.
When you say long term, do you mean like many months or even years?
Years. I take echinacea every day, and I have done for many years.
Okay.
And my herbal lecturer from college and mentor, Professor Kerrybone, he's taken it every day of his life as well. So
I've heard it too. I just want you to share your experience. So it's great that you are letting people know that, you know, not to be afraid of echinacea when it comes to autoimmunity.
So all of my patients who come to me with, say, Graves' disease and hyperthyroidism, I would give bugleweed. I also give echinacea, and I also give that combination of the hemidesmus, feverfew romania, etc., in a tablet. And that's dealing with the autoimmunity and the hyperthyroidism very well. I will often also give them another herb called motherwort.
Which I took. I took motherwort as well when I dealt with Graves.
And motherwort, as far as I know, doesn't have any direct effect on the thyroid, but it's very good for some of the symptoms of hypothyroidism, like the fast heart rate and that sort of thing that can happen, and the arrhythmias that can happen. Works very well, and it's a very nice nervous system tonic too, to help keep people calm. So that's my approach for Graves' disease. If we're looking at Hashimoto's, which is the most common cause of hypothyroidism, another autoimmune disease, then I use herbs like ashwagandha. It's been shown mostly in animal research. A lot of the herbs that we have, due to funding issues primarily, we don't always have good clinical trials on them, but for many of them we do. But for ashwagandha, animal studies have shown that you can, improve thyroid function and thyroid hormone output, etc., from the thyroid. It's another one that I've used a lot, and I use it in combination with bacopa. Many of you will know bacopa as well. It's a herb that we use for, cognition, memory, etc. It's also a nice nervous system herb, but that's been shown in animal studies to improve thyroid hormone output as well. And then, of course, I use bladderwrack, which contains iodine, and that's the main reason that I use it. And iodine is a key constituent for thyroid hormone production. If you don't have enough iodine, you can't produce thyroid hormone in the body. So, that's a really nice combination that I use to sort of support improving thyroid function rather than dampening it down in my patients.
Okay. So
very good results.
All right. So for Hashimoto's, again, that you recommend ashwagandha, bacopa, bladderwrack, and then you mentioned Graves. You meant the bugleweed, motherwort, hemidesmus, and echinacea, correct?
Yeah, yes, and the hemidesmus and echinacea for Hashimoto's as well.
Okay, so hemidesmus, echinacea for both autoimmune conditions.
Autoimmune disease, in fact, yes.
Okay.
And I also sometimes use coleus as well for Hashimoto's or low thyroid function, because it does also improve thyroid output as well. And it can reduce body fat, which is sometimes an issue when we have low thyroid function. And there's been a few clinical trials showing that coleus can do that.
Interesting. I didn't know that. So coleus could reduce body fat in some cases?
Yeah, yes, absolutely. Yes. You need a good dose of coleus to do that. And I use coleus in my clinic as a tablet for that purpose, and for low thyroid. And the active constituent in coleus is called forskolin. And in the clinical studies, they've used, doses of forskolin per day that I can get. I think they use 50 milligrams of forskolin per day in the coleus they used in the clinical studies. And I can get that in using 3 of the coleus tablets that I use in my clinic every day. So that's what I use in my thyroid patients, because it helps thyroid, but it also helps them to lose body fat as well, which is important.
A couple of quick questions that I know people are going to have. Like, one is going to be the iodine in the bladder act. There are some people that, no question, iodine is necessary for, the production of thyroid hormone. But then there's some concern with iodine exacerbating, some thyroid conditions, hypothyroidism, hyperthyroidism, but also the autoimmune component. So even with Hashimoto's, there are some that say, stay away from iodine completely, even from a food perspective. So
Yeah.
again, what are your thoughts on that? Obviously, you've had a good experience with the bladder rack over the years with your Hashimoto's patients, and you said you yourself have Hashimoto's as well.
Yes, absolutely. And look, iodine can increase the level of the autoantibodies that we find in Hashimoto's. But you probably need higher levels in order to do that. You can't avoid iodine. You just can't avoid iodine, because low thyroid function and goiter, for example, we don't see goiter so much now because we have an understanding of what causes it, and it's iodine deficiency. And there's certain areas in the world where the soils are very iodine deficient, and there's places in Australia where that's the case, where before we realised what was happening, you would see a lot of people in those areas with goiter. So you can't avoid iodine. It's not good for your thyroid, but it's also not good for a whole lot of other tissues in the body. It's not only the thyroid that requires iodine. So the amount of iodine in the tablet I use with bladder rack in my clinic is not very high. And I've never, ever seen an issue. However, sometimes you do read, teachers will say that, and to be quite honest, most of this I've seen come out of the United States, where some people will advocate hugely high doses of iodine. Iodine is usually prescribed in the microgram dose, and you'll see them prescribing huge doses of iodine. And I've never been a fan of that, and I've never done that in my clinic. I've actually never prescribed iodine as a separate supplement in my clinic. When I give it to patients, it's always in the bladder rack, because you've got a complete herb there. It's not just straight iodine, and that's very important, I think, when we're talking about herbal medicine in particular. So if you've got too much, really high levels of iodine, you can see Hashimoto's occur as well. And they've seen this in some areas in Japan, particularly on the West Coast, where they eat huge amounts of seafood and seaweed. They get huge amounts of iodine, and they see a lot of goiter and Hashimoto's there because of too much iodine. If you're taking some bladder rack prescribed by your healthcare practitioner at the correct dose for you, you're not going to see those issues at all. So, it's very important. And we can do, if we're thinking, well, should I be giving this patient something with iodine in? We can prescribe for a patient's iodine level testing. And I generally do that with urine testing. I do a 24-hour collection urine sample and get patients to have that tested. So that gives us an indication, is there iodine already high? Well, then obviously I wouldn't use it, but often it's low. And it's very rare, unless people are supplementing with high doses of iodine or eating huge amounts of seafood and seaweed, which we do not see in most of our patients. They're not going to have high iodine. It's more likely to be low. But when in doubt, as practitioners, we test.
Yep, good points. And thank you for sharing that. And then ashwagandha. Some people are concerned about, first of all, ashwagandha being a member of the nightshade family, and some people don't do well with nightshade. So I wanted you to mention that. And then also with ashwagandha, since it could help in some cases with thyroid hormone, with lower thyroid hormone levels to increase it, should those with hyperthyroidism avoid ashwagandha?
Okay. People with hyperthyroidism should avoid ashwagandha. Yes, it's a fabulous herb. It's one of my favourite herbs, I have to say, and one of my most prescribed in my clinic. But it's not the adaptogen and nervous system herb to give to your hyperthyroid patients. So, and in fact, I have read some research case report where a patient developed hyperthyroidism or was diagnosed with hyperthyroidism after taking, reasonable doses of ashwagandha. And it may well be that that patient already had borderline or undiagnosed hyperthyroidism, and then the ashwagandha just made it worse, so that the symptoms were much more obvious. So, if you've got normal thyroid function and your thyroid's healthy, ashwagandha is not going to suddenly make it overactive. I don't think I've got a single patient in my clinic that hasn't had ashwagandha at some time. So it's a fabulous tool, but not for hypothyroid patients. As for it being a nightshade plant, it is indeed. And I have used it in patients who do have a nightshade sensitivity without problems. One patient I had once, she said, I absolutely cannot have anything in the nightshade family. Do not give me anything. I never gave her ashwagandha because I thought if I give it to her and I exacerbate something, that's not going to be good. But, sometimes you don't even know. Patients mightn't even think to mention they've got a nightshade sensitivity. When you see them at the first consultation, you give them ashwagandha, and it might be something they mention down the track a little bit. And they've been taking the ashwagandha with no ill effects. It's one of the things in clinical practice, we never get all the information in the first consultation.
Yeah, no, thank you. Thanks for so it sounds like, most of the time you don't see a problem with your Hashimoto's patients when it comes to ashwagandha. So it is something you give pretty much to everybody, it sounds like. And then if someone, just like with any herb, besides the nightshade, anybody could have a negative reaction to any herb. So obviously if it's not agreeing with them or another herb, you'll obviously just tell them to stop that herb.
Absolutely. And that happens in clinical practice. They're what we call idiosyncratic reactions, where they're a reaction that's very uncommon and is totally unpredictable. So it's the same as, people can suddenly develop an allergy to nuts, in midlife, for example, that they've never had before. It's unpredictable. So, in my practice, if somebody comes back and says, look, this herb just doesn't suit me, this is what's happening, then I'll take them off that. For most herbs, as I said, not all, but for most, we can bring other herbs in that will have very similar activity. Ashwagandha is excellent for the thyroid because for improving thyroid, not only because of its seemingly direct action on improving thyroid hormone, but also it helps to improve energy. It keeps people calm. And you could think with low thyroid, because it's low metabolism, your energy is low, you can be calm. But you can sometimes have thyroid patients that are very low energy, but they also feel quite anxious, they're not sleeping well, etc. So ashwagandha is very, very good for that. And the bacopa that I talked about, as well as improving thyroid hormone, it's also a really good herb for concentration and memory, which is lacking when you've got low thyroid as well. And it also gives you that nice nervous system support. So with the beauty, I think, of herbal medicine is that all herbs have multiple actions, not just one. So when we give a herb to someone, we're not just doing one thing, we're doing multiple things.
And ashwagandha,
know about yet, probably, for many of them.
Yeah, I was going to say ashwagandha also great for the adrenals, which also could cause low energy. And so from what I understand, also it could be taken whether someone has high cortisol or low cortisol, correct?
Absolutely. Absolutely it can, because it supports the adrenal. The adrenal gland produces cortisol. And if it's producing too much cortisol, we need to support the adrenal gland so it doesn't just basically wear out from doing that, which happens. And then we get very low cortisol. But if there is low cortisol, then we need to support the adrenal gland to do what it does in producing the correct amount of cortisol. And really what we're talking about here is not just the adrenal gland, we're talking about the HPA axis, the hypothalamus pituitary adrenal axis, which really controls our response to stress. And the adrenals are the last port of call there, if you like, and that's where the cortisol is produced. So herbs like ashwagandha support that whole HPA axis, not just the adrenals, the whole HPA axis. And they're called adaptogens because they help us adapt to the effects of stress. And when we're talking about the adaptogens effect on the adrenals, They don't have a direct effect per se on the adrenal, but what they do is they spare the adrenals from the adverse effects of the stress that we're experiencing, because they're improving the activity of that whole HPA axis. So I think these adaptogenic herbs that we have, and we're very, very, nature's been amazingly generous. I think these are the real key herbs for our modern lifestyles, because they help us adapt to the stress that we experience. Most of them help to improve immunity in one way or another, and most of them will help to improve energy and sense of well-being, etc. And they're all things that are fundamentally essential in our modern lives.
Yeah, no, you're right. And again, thank you for sharing this. And one other herb I want to ask you about, if you have any experience with, is lemon balm, because that is also commonly given with those who have hyperthyroidism,
Yes,
especially.
thank you for reminding me. Lemon balm can improve hypothyroidism as well, and it's also a really nice calming herb. So, yeah, and it does help digestion in some people if stress affects their digestion, then lemon balm can help with that as well. So that's another one that I often use in my hypothyroid patients. Yes.
All right, wonderful. Yeah, I personally did not take lemon balm when I dealt with Graves, but I do have some people with hyperthyroidism take it. Definitely bugleweed is my main go-to, as is with you, and then motherwort is probably number two as far as the herbs that I give for those with hyperthyroidism. And yeah, lemon balm's on the list too for some people. But
Yes.
yeah, I want to respect your time, but is there anything else that you'd like to share? You shared so much, so if not, that's fine. Again, I appreciate the time you spent so far, just going over all these herbs.
No, look, I think thank you for the opportunity. But as a practitioner, things that I think are really important, if you're going to feel better with taking herbal medicine or any medicines, is to see a healthcare practitioner in order to have the correct medicines prescribed at the correct doses, and to be sure that you're getting good quality medicines. I personally would never go online and purchase a herbal medicine where I didn't know where it was made, how it was overseen in that manufacturer. Because, when I went into naturopathy, when I went to college, and I'm still very altruistic, but, I sort of was under the assumption that the whole herbal medicine industry would be very altruistic, though it's actually not. And there's a lot of deliberate adulterations and substitutions that take place, and there's a lot of accidental ones. So you have to make sure that you actually, using a product where all that testing has been done, so you're guaranteed you're going to get good quality, safe herbal medicines.
All right, well said, and thank you so much, Berris. Appreciate you sharing your knowledge. Again, I learned a lot, and I'm sure the listeners did as well.
Thank you very much.